Courtney Turner. I'm a psychiatrist here in Highlands. I've been here for a couple years. I have an office here at Archer Clinic.
May is National Mental Health Month. Can you tell us why it is important to care for your mental health just as much as your physical health?
Mental health is just as important as physical health because it affects everything that you do. A big part of the reason I decided to go into psychiatry was because it didn't matter where I was, whether I was on family medicine or surgery or OB, there were people who had mental health issues. Until those things got better, their physical health would never get better. It's hard to treat your diabetes and be motivated if you're depressed. It's hard to care, be motivated enough to make those lifestyle changes if you're feeling really down. Just as you shouldn't neglect your diabetes, I think it's important to treat mental health issues as well.
How important is early detection of mental health issues for overall health?
It's very important. The earlier that we know about a mental health issue, typically the better we can treat it. People who have had one depressive episode are much more likely to respond to our treatments than if they've had 3, 4, 5, 6, upwards of that. And your prognosis is much better with early detection, just like most other medical issues.
Although most mental disorders are treatable, in the United States approximately 60% of adults and almost 50% of youths with a mental disorder did not receive treatment in the past year. What would you say to those suffering to encourage them to seek help?
My biggest phrase is that you're not alone. People feel very stigmatized in seeking help, and that it somehow implies that there is a defect in them or that they are weak or there's something wrong with them, and that's just not the case. I think we need to take away that stigma that it's somehow somebody's fault.
What can family members do to help those they suspect are suffering mental health issues?
I always like to tell family members to just be very supportive. Whenever they are ready to seek treatment, be there. Be a good sounding board, be supportive for them in any way that you can. I think when people feel like they are being heard and understood, then that's when they're most likely to seek treatment.
What can we as a community do to decrease the stigma that surrounds mental health?
I always encourage people to share their struggles. We have all sorts of platforms for that nowadays. Social media is everywhere. I have plenty of people who come in here and tell me that they decided to get help because they wanted to show their family members or friends that it's okay to get help. I also like to point out to people that getting help doesn't mean that you're weak. It actually means that you're strong, because it's a lot harder to walk into my office or anybody else's office and admit that you have a problem and seek help rather than to cover it up.